the bad habit that raise your diabetes risk. Let's come and see about diabetes and other behavior risks that lead you to get diabetes.
4 bad habits that raise your diabetes risk: obesity, physical inactivity, unhealthy diet, overweight peer group, and other uncontrollable risk factors. Race, age, 45 years or older, family history, both your gene and your childhood environment, history of gestational diabetes. Many people have this behavior and disorder in the body and wonder if that's what the symptom of diabetes. What is the first clue of diabetes? Some of them include excessive hunger or thirst, fatigue, weak and dry, frequent urination, especially at night, unexplained weight loss, blurred vision, cut and wound that heal slowly, reduced sensation in hand and feet, breathe with sweety and fruity odor.
The diabetes is the common disease that every people know well. The definition of the diabetes is you have a higher blood sugar or blood glucose. The glucose is come from the food that you eat, and the insulin hormone is very helpful to take your glucose get back into the cell and give them energy. With the type 1 diabetes mellitus, it is about the cell cannot make the insulin. The type 1 diabetes mellitus is characterized by the loss of the producing cell of the insulin, leading to the insulin deficiency. And the diabetes mellitus type 2, it is about the cell cannot make the insulin and the cells cannot use the insulin well. With the type 2 diabetes mellitus is characterized by the insulin resistance, which may be combined with the insulin reduction secretion. And the defective of the responsiveness of the insulin may be involved the insulin receptor. You may also have the pre-diabetes. That means you have a high blood sugar or blood glucose than the normal range, but not enough to cause the diabetes. Having the pre-diabetes can put you at a higher risk of the diabetes type 2, which is the common diabetes.
If you're having diabetes and you don't control your blood sugar level, it can lead you to the other disease, in term we call the diabetes complication. The diabetes complication can be divided into 2 groups. First, acute complication, for example, hyperglycemia, hypoglycemia, ketone acidosis, and non-ketotic hyperosmolar coma. Chronic complication. Chronic complication is due to a mix of microangiopathy, macrovascular disease, autoimmune disease, and female infertility. In terms of microangiopathy, it includes of, first, neuropathy, a loss or decrease of your sensation of your nerve. 2. Nephropathy, a damage to your kidney, which can be lead to the renal failure. 3. The retinopathy. The retinopathy is the swelling or edema in your retinal blood vessel. And the most common chronic complications as people well known are, first, the stroke. The stroke is a hemorrhage of artery or vein in your brain. 2. The cardiac disease. Cardiac disease is an obstruct of cholesterol, fat, or biochemical complex in your vein or artery. And the last one is foot ulcer. Foot ulcer is due to a mix of angiopathy and a vascular damage, which will lead to be a tissue necrosis, cell death, and a gangrene.
How does the doctor test diabetes? Getting diagnosis for diabetes. The doctor will repeat the test that is high in order to confirm the diagnosis. First, the fasting glucose test. A test of your blood glucose level taken in the morning before you eat. If the level is 126 mg per deciliter or higher, that means you have diabetes. The A1C test is a test that shows your average blood sugar level in the past of 2 or 3 months. If level is 6.5% or more higher, it does mean you have diabetes.
This guide to testing your blood glucose level should get you started. From your fingertip, you prick your finger with a small sharp needle called lancet and put a drop of blood on a test strip. Then you put the test strip into a meter that shows your blood sugar level. You get results in less than 15 seconds and can store that information for future use. You can get blood sugar meters and strips at your local pharmacy.
However, you can testing your blood glucose level by yourself by blood glucose meter to check your blood glucose level. The result can help you and your doctor manage your diabetes.
These are simple steps to preventing diabetes. Cut sugar and refined carbs from your diet. Eating foods high in refined carbs and sugar increases blood sugar and insulin levels, which may lead to diabetes. Working out regularly. Performing physical activity on a regular basis can increase insulin secretion and sensitivity. Drink water as your primary beverage. Lose weight if you are overweight or obese. Carrying excess weight, particularly in the abdominal area, increases the likelihood of developing diabetes. Quit smoking because smoking is the strongly linked to the risk of diabetes. Avoid sedentary behavior. Eat a high-fiber diet and optimize vitamin D because it's very important for blood sugar control.
You don't have to eat less, you just have to eat right.
Healthy body is the best gift of your life.